Hi, my name's Kelly. I'm a psychologist and CBT therapist, and today we are going to be talking about body image. We're going to be talking about maybe if you or someone that you're working with doesn't have that great of a body image. It could be linked to poor self-esteem, it could be linked to potentially low mood, it could be linked to a whole heap of things. I'm going to be exploring 4 of the different areas that you can work with someone or work with on yourself when you are experiencing poor body image or just finding it really difficult to accept or like your body. So the first area that we want to explore is checking. Now, as I work through 4 of them, they may not be applicable to everyone, but they are really important to explore. So checking could be looking in the mirror quite a lot, it could be looking at pictures, it could be looking at a range of things, but it's about checking out someone's appearance. And what you want to know is how often are they checking and how long are they checking for? Are they spending 10 minutes or more in the morning checking their face? Are they looking for any blemishes? Are they looking for any changes in their body shape? And really just noticing what are they checking for, or even if they're wearing clothes, are they constantly checking it and pulling it down? They're kind of not preening, but like just checking for certain things, or being really kind of hyper vigilant to their appearance. And what you really want to do with that is first to really explore what they are doing, why they are doing it, and how it really makes them feel. And then what you want to do is almost like ERP, so exposure response prevention. You want them to be able to almost create a hierarchy of the things that are easier to reduce and the ones that are less easy to reduce. And you just work your way up. So you look at potentially maybe looking in the mirror in the morning is the easiest to change, but potentially checking throughout the day is harder. Maybe there's it before a big meeting or before going out, something that checking really elevates. So you want to think, okay, so how much are they checking, kind of get that hierarchy, and then doing some exposure, so getting them to set experiments for themselves to reduce that checking. And you agree a certain amount that you're going to reduce to. It could maybe be 0, or it could just maybe be just checking once for a time period, a set period of time. And then you just work through the hierarchy, so doing the exposures and working your way up until they're not really checking in all the different areas that they are before. So, and the second one that we would look at is reassurance seeking. So an individual might find themselves seeking reassurance from friends, from colleagues, from family members, even on social media. So being aware of what type of reassurance are they seeking. Are they going up to someone and saying, "Oh, you look really fat today, I look horrible," and kind of expecting someone to say something back? Or are they kind of, "Oh, does this look okay? Should I go and get changed?" And maybe changing their outfits quite a lot. Or are they kind of putting things on social media that kind of like thumbs up or thumbs down, or requesting comments, seeking reassurance from other people? Because what we want someone to do is have that strength within themselves to not want to seek reassurance from other people, to be able to give that to themselves, to know that they look okay. Because we know if that person wasn't there, how are they going to get that reassurance for themselves? So it's really about being aware of how someone is seeking reassurance, and again thinking about using the hierarchy. You could even put them both together, and getting them to reduce that reassurance seeking, get them maybe to think about how they could reassure themselves. And that may come with some thought challenging and stuff like that, but you really want to explore the level of their reassurance seeking. Then the third is altering someone's appearance. So this could be simply as growing a beard to cover part of their face. It could be wearing their hair, maybe not like that, but wearing their hair like this to kind of cover part of their face. It could be about wearing maybe certain clothes, or kind of like a baseball cap, or certain things to mask or hide some of their appearance. Or it could even be plastic surgery. So it's thinking about what sort of thing is this person doing to alter their appearance. And again, can we do experiments to challenge the thoughts that are behind it? So you want to maybe use some behavioural experiments. So they may believe that if they weren't to wear a baseball cap, that everyone's going to stare at them, but everyone's going to stare at them really, really intently and maybe not look away for at least 30 seconds or more. So you really want to be able to operationalise it. So why are they changing their appearance, and what do they believe is going to happen if they revert to maybe how their appearance was before? And again, that's more difficult with cosmetic surgery. That's something you can potentially delve in and explore in a bit more detail. But really, again, thinking, testing out these predictions, testing out their thoughts. What do they think is going to happen? Can we try that out? And if you're able to do that with the client, that will be even more powerful. So I've done it before that a client would always have their hair down like this because they were really, really fearful of blushing. They thought that loads of people will look at them and recognise it. So what I did, put loads of blusher on, we went out with them and I got them to score how many people looked at me. And I'm not going to give away what happened because you can try it out yourself. But those sorts of things, you can do it together. So really, really kind of creating that close bond. And as I said, if you are doing this on yourself, thinking about, okay, so what am I predicting is going to happen in this situation? What experiment can I set up? Being a scientist, okay, so this is my hypothesis or this is my prediction. What can I do to test this out? Go and test it out, then go back to your prediction. Did what happened, did what you think happened happen? Or did something else happen? What did happen? What was your learning point? And you want to keep predicting this, keep doing this experiment. It may not be enough just to do it once. So you really want to get that client to challenge those predictions, challenge those thoughts. And the same with reassurance seeking. It's the same with checking their appearance. They may think that there may be a prediction that if I don't check my appearance, then someone's going to comment on me. So if that's the case, move a little bit away from ERP. You're not really exposing, you're doing more of a behavioural experiment. And I have got videos on my YouTube about behavioural experiments and about exposure response prevention, ERP. So if you want to know a little bit more about the definitions between the two, check that out. And then the fourth one that we want to look at is avoidance behaviours. And this sometimes is potentially the most common that you see, but people will avoid things because of their body image. They may avoid wearing certain things, they may avoid going to certain events, they may even avoid getting into certain conversations with people. So you really want to explore what is it that you or the person that you're working with is avoiding. And again, thinking about, okay, so what is the reason that you're avoiding that situation? Can we put it on a hierarchy? Are there some things that make you feel maybe 4 out of 10, maybe a little bit anxious or uncomfortable? Could we work that? Or is there some that are 10 out of 10, like, nope, not doing that? And you put them on a hierarchy and you just work through them. And you need to decide with your client if you're going to do it as exposure response prevention or if you're going to do it as a behavioural experiment. So remember with ERP is that someone's exposing themselves to a situation that makes them feel uncomfortable and they're not responding to that uncomfortable feeling like they normally do. So with avoidance, it may be that they go to a party and they normally leave pretty straight away. So you've got them to stay in that situation until their anxiety or their uncomfortableness drop by half. Or it could be that they go to a party, but they'll always sit in the corner. So if that's the case, you maybe want to do a prediction. Okay, so what do you predict is going to happen if you move out of that corner? And then getting them to go through that exercise together. So they're the 4 different areas that really kind of cover all angles within poor body image and how you can either bring it into your session or how you can work with a client to create those changes. I hope you found that helpful. I've got lots of other videos on CBT skills, psychological techniques. Please check them out and let me know what you think. Yeah, hope you found that helpful. Take care.